Good morning, good afternoon, and good evening, the American Society of Echocardiography Conference attendees. I would like to thank the scientific committee for inviting me to deliver this talk. Today, I'm going to talk about the emerging echocardiography technology in Saudi Arabia. One of the projects that have been adopted by Ministry of Health called the TAGI solution. This is a national project. The aim of this project is to connect the cardiac centers across the country to one data center in Riyadh. This solution will help these centers to exchange the data for the same patient and wherever he goes, wherever he is admitted in the country, as well as utilizing the limited numbers of cardiologists for the echocardiography reporting and for other telecardiology services as well. This solution will connect 8 hospitals that contains 8 cardiac centers operated by Ministry of Health. The aim of this solution will make each site need to be able to operate independently. And this solution powered by a unique cardiovascular information system installed and operated by one of the leading company in the market. The solution, as you can see, connecting 8 cardiac centers to one data center in Riyadh. This operated by a group of consultants and technicians as well as data expert. This is making one network solution to connect cardiology care across 8 hospitals. This will drive fully digitalized centers for invasive and non-invasive cardiology workflow as well. This service will enable the telecardiology across the hospitals. For example, a patient needed to have further third or second opinion in the center can be connected to the expert in the center. And the telecardiology was applied in one of the, as a pilot in one of the cardiac centers in the central area, and to be cloned in the other centers later. This is the phase 1 of the project. As you can see, the cardiac centers, they do have their own cardiovascular information system and they do have own archiving system. This archiving system and cardiovascular information system will be connected to the Ministry of Health data center in the central area using a unique vendor neutral archiving system and unique XDS system, which is the solution that enable these centers to exchange the data and the imaging at the same time, data of the patient's information and the imaging for the same patients. This solution will enable different hospitals and centers to have cross exchange of their patients' data across the country. For example, if the patient needed to have an echo reported by another consultant in another hospital, the echo will be uploaded to the central back system in the hospital and then to the central data center in Riyadh, and this per se will exchange the data and notify the other doctors, consultant, echocardiography in the other hospital to report this echo, and sent back again to the same hospital who ordered it. The system will enable the centers or the hospitals or the cardiology services to have cross usage of the same data for the same patients as well. The system will have open data for all the cardiac centers from different sites, and in case of there is limited numbers of doctors, there will be an on-call doctors. Another hospital will report the echo in that area. So another benefit of this system in case of disaster, the solution will allow the affected hospital to use the other data center in the nearest area and utilize the data from the data center archived in Riyadh data center. In case of a patient brought with him an echo that had been done in outside the institution, this study will be archived in the same site using the DICOM technology. Other labs across the country, they are using the emerging technology. Most of the labs nowadays, they are using the strain in their daily practice echocardiography and using different vendor for these studies. The strain is helping to establish the ischemic heart disease or suggestive ischemic heart disease to go further either for CT angio or coronary angiography. And as you can see, the benefit of this technology is going to be utilized extensively in our echo labs in the country. The 3D technology is used extensively in our labs in different cardiac centers, and the utilization of this technology is getting better and better to have a proper diagnosis for cases. For example, this patient, if without the technology applied here, which is the 3D technology, we cannot know the mechanism of the mitral regurg in this case. As you can see, the cleft in the posterior mitral leaflet. And this is the benefit of the 3D technology in the applied on daily basis. In addition to the 3D, if you are using the same technology, you can go further for a new technology, which is the True View, and you can get the benefit of this technology with much better clearance of the pathology of the disease. For example, as you can see in this case, there is a vegetation on the posterior mitral leaflet, but we don't know the mechanism. This patient have acute fever and found to have blood culture positive for Staph aureus. The TrueView technology showed, the TrueView technology showed that there is an abscess rupture in the same posterior mitral leaflet. The another technology that are nowadays used extensively as well in some labs, and this technology we are doing it in our lab, the transthoracic 3D. The benefit of this study is sometimes will help us not to do the invasive like doing the transesophageal. So as you can see, the vegetation appeared on the mitral leaflet, and this is very beneficial sometimes to decide whether to go further or not. And by this technology, we will end to our talk. Thank you very much.